Hello viewers, today we will discuss about antipsychotic drugs. The following topics to be discussed here. So definition, mechanism of action, classification, structure and uses. So before that we should know that what is the meaning of antipsychotics. Antipsychotics are medications also known as neuroleptics. They are categorized in terms of typical and atypical. They works by blocking dopamine receptors and they are by reducing the psychotic symptoms. These drugs are used to treat psychotic disorders. So, what are the disorders here? So, difficult concentrating, depressed mood, sleeping too much or not enough, anxiety, suspiciousness, withdrawal from family and friends, delusions, hallucinations. Let's come to the classification of antipsychotic drugs. So, based on these structures, one is phenothiazine structures, beta phenomon, thiazolines, and other heterocyclic compounds, atypical antipsychotic drugs. First, come to these phenothiazines. It is divided into three types. One is aliphatic side chain, piperidine side chain, piperazine side chain. So, in aliphatic side chains, chlorpromazine, trifluoropromazine, piperidine side chain, thioridazine, piperazine side chain, trifluoropiperazine, flufenazine. Next, butyrophenones such as haloperidol, trifluoroperidol, penfluridol, thiazolines, flupenthiazole, other heterocyclics such as pimoside, laxapine, atypical antipsychotic drugs such as clozapine, risperidone, olanzapine, quetiapine, aripiprazole, ciprofloxacin. How is mechanism action? So main concept is the blocking the dopamine receptors in the brain. So all the first generation and most of the second generation antipsychotic drugs block the dopamine receptors in the brain and periphery. Clinically, efficacy of typical antipsychotic drugs correlates closely with their relative ability to block D2 receptors in the mesolimbic system of the brain. For example, haloperidol and chlorpromazine. These type of drugs block the dopamine D2 receptors in the dopamine pathway of the brain. This means dopamine released in this pathway is very less effect. Excess release of dopamine in the mesolimbic pathway has been linked to psychotic experience. So, what the main concept is? These are drugs block the dopamine D2 receptors, release the dopamine. If it is released also, it has less effect in this pathway. So coming to the structure and uses, chlorpromazine hydrochloride. This substance comes under phenothiazine category, used to treat psychotic disorder such as schizophrenia or manic depression in adult, and also used to treat nausea and vomiting, anxiety before surgery, chronic ICPUS, acute intermediate porphyria, and symptoms of tetanus. So, what is the meaning of schizophrenia? Here, a long term mental disorder of A type involving a breakdown in the relation between thought, emotion, and behavior, leading to fault perception, inappropriate action and feeling, withdrawal from reality and personal relationship into fantasy and delusions, and a sense of mental fragmentation. Next drug is sulfide. Sulfide is a atypical antipsychotic drugs. This is mainly used to treat schizophrenia and major depressions disorders. Next drug is promosine hydrochloride. This also comes under phenothiazine category. It acts by blocking a variety of receptors in the brain, particularly dopamine receptors. Trifluoropromazine. The trifluoropromazine is used to control violent behavior during the acute episodes of psychotic disorders and also used to treat severe nausea and vomiting. Next is thioridazine hydrochloride. So this is one of the antipsychotic medicines called as phenothiazines. It works by changing the actions of chemicals in your brain. It also used to treat schizophrenia. Piperacin, piperacetacin hydrochloride. This also comes under antipsychotic drugs, mostly used to treat schizophrenia. Next is perchloroperazine malate. This also used to severe nausea and vomiting. This all comes under phenothiazine category. Trifluoroperazine hydrochloride. This also used to treat mental or mood disorders such as schizophrenia, psychotic disorders. Next is chlorprothoxin. These are mainly used to treat psychotic disorders, schizophrenia as well as. Next one is thiothiaxin. Thiothiaxin is a group of medication called as conventional antipsychotic drugs. It works by blocking or decreasing abnormal excitement in the brain. Next one is laxabin succinate. This is also one of the drugs comes under antipsychotic drugs mainly used to treat mental or mood disorders. The medicine helps to use think more clearly, feel less nervous, and take a part in everyday life. Next one is clozapine. Clozapine is an antipsychotic drugs. It is mainly used to change the chemicals in the brain. Clozapine is mainly used to treat schizophrenia and other treatment have failed, and also used to reduce the risks suicidal behavior in the people with schizophrenia or similar disorders. Next drug is haloperidol. Haloperidol is one of the antipsychotic drugs. It is analogy called as haldol. It also used to decrease excitement in the brain. Haldol is used to treat psychotic disorder like schizophrenia and also used to control motor and verbal tics and used in the to use to treat severe behavioral problems in the children. Next is droperidol. Droperidol is a sedative tranquilizer and nausea medicines. Droperidol is used to reduce nausea and vomiting caused by surgery or other medical procedures. And also used to treat for purpose not listed in the medications guide. Next is risperidone. Risperidone is used to treat mental or mood disorders such as schizophrenia as well as bipolar disorders. Mainly occurs in children. Molybdenum cytochloride. So molybdenum is used to treat certain mental or mood disorders such as schizophrenia and also used to helps to think more clearly, feel less nervous and take part in everyday life. That's all. These are the structural uses for antipsychotic drugs.